congenital anomalies of the tongue, and these will be explained from some aberration in the developmental process of the tongue. So we'll talk about 6 congenital anomalies. The first one is aglossia, which is the complete absence of the tongue. This will happen when there is no lateral lingual swelling, no tuberculum impar, no hypobranchial eminence developing, and as a result of which there is a complete absence of the tongue. Second one is hemiglossia. As the name suggests, hemi meaning half, one half of the anterior 2/3 of the tongue is suppressed. And why does this happen? This happens because of the non-appearance of lingual swelling on that affected side. As a result of which, you'll only have one half of the anterior 2/3 of the tongue. Third one is the lingual thyroid. Lingual thyroid is a very important short note, and you can also get some clinical cases in your PG. I'll talk about it completely in a separate video, but just to give you an overview, why does the lingual thyroid form? When the median thyroid rudiment fails to grow caudally and persists within the substance of the tongue, it leads to the formation of the lingual thyroid. So when I'll talk about the thyroid gland development, I'll tell you about how when this median thyroid rudiment, first it forms in the tongue, but it undergoes a migration towards the anatomical position of the thyroid gland and undergoes development over there. When this process is interrupted for some reason and it has not gone forward and it stays within the substance of the tongue itself, you find thyroid gland tissue within the substance of the tongue itself, and that is what is known as lingual thyroid. The fourth one is thyroglossal cyst. Again, thyroglossal cyst is a very important short note. I will be discussing it in another video, but just a short little bit about it. Thyroglossal cyst, it develops because when the remnant of the thyroglossal duct persists anywhere in the path from the tongue to the normal anatomical position of the thyroid gland, it forms a midline cystic swelling which is known as the thyroglossal cyst. So it's basically a remnant of the thyroglossal duct. Fifth one is Ankyloglossia or tongue tie. I had spoken about this in the video on the anatomy of the tongue when I was talking about the different structures, and you remember I have spoken about frenulum linguae, which is a mucous fold attaching the tongue to the floor of the mouth. When this frenulum linguae is shorter than usual, it leads to formation of tongue tie, and in this situation you will see there is disturbance of speech seen in the patient. And lastly is bifid tongue. This is a very rare anomaly where what happens is the tip of the tongue is split longitudinally. This happens because of a problem in the fusion of the lateral and the median swelling during the fetal development. The lateral swelling being the lingual swelling and the median swelling being the tuberculum impar. When there is a disturbance in their fusion, then we see that the tip of the tongue has a longitudinal split, and this is known as the bifid tongue because it seems like it has two tips. There are two tips of the tongue.